Hi, folks. Today is Tuesday, April 21st. And as I said, I'll just bring you a little quick update every night with results. We get our final written results back from the Friday testing with no changes from what we had talked about yesterday. So that's great news. The way the result procedure goes, Convenient MD lets us know if there's a positive result, sort of real time. They'll give us a call. And we don't hear about negatives or actually see the list of negative results until we get the written report. So never in my life have I wanted to be negative more, and never in my life have I wanted my phone to not ring more than I do right now. And so the good news for today, anyway, is that with nearly all and potentially all of Saturday's results in, we've not heard any reports of positive tests. And we did just about 400 tests on Friday, representing our RiverWoods Exeter staff, our RiverWoods Durham staff, and our RiverWoods Exeter healthcare residents. So that won't be final. We won't know for sure until we get a written report. We hope that will be tomorrow morning, but it's possible that we won't have that until Thursday. And at this point, they've also started to get in results from Sunday's testing. And again, we've not heard of any positive cases. So that's all good news so far. A few other things we did this weekend. I think I mentioned this earlier, but we did testing for a number of other long-term care workers from other facilities around the Seacoast. And you know, the reason that makes me so happy is you think about, like, in times of crisis, sometimes you can get protective and small. And what I'm so proud of is that our team in Exeter and Durham and Birch Hill and all of you, we've taken a broad view. You know, this is about our family of communities. This is about protecting one another, but it's also about all long-term care workers. It's also about all older adults. It's also about really all the state of New Hampshire. This isn't just one campus or one community fighting against a virus. We're all in, and we're all in it together. And I'm super proud that that's the approach we're taking, that people embrace that approach. That's what we need right now as a system, as a industry, as a state, and as a nation. Last thing I want to just touch on in an example of how we're all in this together and we're all in. We established an employee emergency fund, knowing that some of our folks are going to have some pretty good financial stresses in the next period of time because our economy, changed on a dime in March, and they may have illness. They may have a spouse or a partner who's lost their job because of the change in the economy. And at this point, just I think a week or two of us talking about this and thinking about this, we've raised just about $110,000, about $30,000 from our leadership team, from the TRWG staff and our executive directors, about $80,000 from you all, from our residents, and even some of our staff have contributed. So to help their teammates and friends. So that's what we're about. We are about helping one another. We are about being in this together and being a family full of people who care about one another, who care about their teammates, who care about older adults, who care about staying healthy, strong, with clean hands and 6 feet apart. So thank you. Thank you for your contributions. Thank you for all of you who have contributed in other ways by making masks, making gowns, and by saying thank you to our team and all of us working hard every day. So have a good day, and we'll be back tomorrow.